What if the medication you take to protect your heart, your blood pressure, or your blood sugar is quietly lowering your sexual performance without you ever connecting the dots? In this video, I'm going to break down 5 extremely common medications that research suggests may be linked to erectile dysfunction. And I'll give you a safe, practical plan for what to do if you recognize yourself in this, without panic, without shame, and without doing anything dangerous. Here's the question. If the problem isn't you, what if it's your daily meds? Before we touch the list, you need one key idea. An erection isn't a mood, it's physiology. It's a coordinated event between your brain, nerves, blood vessels, and hormones. Here's the simple version. Something turns you on, visually, emotionally, physically. Your brain sends a signal through your nervous system. Blood vessels in the penis relax and open. Blood flows in. And then the body traps that blood long enough for firmness. So when men say, "I want it, but my body isn't cooperating," the problem is often not desire, it's the system. And medications can interfere with that system in 3 main ways. First, they can reduce blood flow or make blood vessels less able to relax. That's like trying to inflate a balloon through a kinked hose. Second, they can dampen nerve signaling, so the turn-on message arrives weaker or slower. Third, they can shift hormones, especially testosterone, or lower libido. And when desire drops, performance often follows. When researchers look at large health datasets, one pattern shows up repeatedly. Men taking prescription medications report erectile dysfunction more often than men taking none, even when you account for things like smoking, weight, diabetes, blood pressure, and other chronic conditions. Some studies even use genetic approaches that strengthen the argument that for certain drugs, the relationship may be closer to cause and effect in at least a portion of men. Now, that doesn't mean every man on medication will have ED, but it does mean medication can be the missing puzzle piece, especially if the timing lines up. One quick mindset shift. Erectile dysfunction is not a character flaw, it's information. And sometimes that information points to the meds. Sometimes it points to the disease being treated. And often it's both. Now let's count down the 5 common suspects. Number 5, beta blockers like atenolol. These medications are powerful for lowering blood pressure and protecting the heart. And for many men, they're essential. But here's why they can show up in conversations about erections. Beta blockers often work by dialing down the body's fight or flight tone, slowing heart rate and lowering blood pressure. That's good for the heart. But erections depend on blood vessels opening smoothly and blood moving in strongly at the right moment. So for some men, the experience becomes, "I still have interest, but it takes longer," or "it's not as firm," or "it's less reliable, especially when I'm stressed or tired." Important safety note, never stop a beta blocker suddenly. If this resonates, the smart move is to bring it up with your doctor, because depending on your situation, there may be other options that protect your heart with fewer sexual side effects. Number 4, statins like simvastatin. Statins are among the most prescribed drugs in the world for a reason. They lower cholesterol and reduce the risk of heart attacks and strokes. And here's something a lot of men miss. High cholesterol and vascular disease can directly damage erectile function. So protecting blood vessels often protects performance long term. So why do statins come up at all? Because cholesterol is also one building block the body uses to produce steroid hormones, including testosterone. So in theory, especially at higher doses, lowering cholesterol aggressively could nudge testosterone down in some men, which might reduce libido and contribute to erectile issues. But let's keep this realistic. Most men don't experience major sexual problems from statins. If you're worried, the best move is not quitting. The best move is tracking symptoms and discussing them with your doctor. Sometimes checking testosterone makes sense. Sometimes the answer is simply improving sleep and stress, because those crush testosterone faster than most men realize. Number 3 surprises a lot of people: aspirin. Yes, over-the-counter aspirin that millions take daily. One proposed reason aspirin may be linked to ED in some men is its relationship to pathways involving nitric oxide. Nitric oxide is like an ignition signal for erections. It helps blood vessels relax so blood can flow in. Now, do not panic. Many men take daily aspirin because their cardiovascular risk makes the benefits outweigh potential downsides. But if you're taking aspirin every day and you've noticed sexual changes, that's worth a conversation. 2 simple questions to ask your doctor. What is the specific reason I'm taking daily aspirin? And do I still need it daily based on my current risk? That's the safe way to handle it. Number 2, another statin, atorvastatin. Same core idea. Cholesterol reduction is generally good for vascular health. But in some men, especially on higher doses or with poor sleep and high stress, libido and erection quality can dip. Here's the key: don't guess, track. Because when you're stressed, memory is unreliable. For 2 weeks, write down quick 1 to 10 scores for sleep quality, stress, alcohol intake, movement, libido, and erection quality. Then bring that to your doctor. That turns "something feels off" into a pattern you can actually work with. Number 1, metformin. Metformin is a cornerstone medication for type 2 diabetes, and diabetes itself is one of the strongest risk factors for ED because it damages blood vessels and nerves over time. Metformin comes up because long-term use can reduce absorption of vitamin B12 in some men. B12 supports nerve health. Nerves matter for sexual response. There's also discussion about possible effects on testosterone in some cases. But here's the most important truth. Uncontrolled diabetes can create permanent vascular and nerve damage, leading to ED that becomes much harder to reverse. So the goal isn't to throw metformin away. The goal is to manage diabetes well. And if there's a side effect, optimize the plan safely with medical guidance. Let me say this clearly. Do not go to your cabinet and start quitting medication. That can be dangerous, sometimes life-threatening. The conditions these medications treat, high blood pressure, high cholesterol, diabetes, can destroy erectile function even more aggressively when uncontrolled. Poorly controlled diabetes can cause irreversible nerve damage. Untreated high blood pressure raises stroke risk. Uncontrolled cholesterol raises heart attack risk. So don't frame this as "my meds ruined me." Frame it as "my body is giving feedback, and we're going to adjust intelligently." Here's a safe, realistic plan. Step 1. Talk to your doctor and be direct. You don't need to be dramatic. You can simply say, "I've noticed changes in libido or erection quality since starting or adjusting medication. I want to discuss options." You'd be surprised how often there are alternatives, different drug classes, different formulations, sometimes different strategies that protect your health with fewer sexual side effects. Step 2. Rebuild your foundation because it multiplies everything: sleep, exercise, nutrition, stress management. If sleep is poor, stress is high, alcohol is frequent, and movement is low, the nervous system won't support consistent performance, no matter what medication you take. Step 3. If needed, ask about timing or dose strategies, but only with medical guidance. Sometimes small changes help without compromising your health. Step 4. Don't ignore ED as a health signal. For many men, ED shows up before major cardiovascular events. Addressing it can be about protecting your future, not just improving sex. If ED starts suddenly over days or weeks, or you have chest pain, shortness of breath, dizziness, or worsening numbness and tingling, get checked sooner. If you want something concrete, here's a simple 14-day reset designed to support blood flow, hormone health, and nerve signaling. 4 pillars daily: sleep, movement, food, stress. And you'll track 3 quick 1 to 10 scores: morning energy, libido, and erection quality. Days 1 through 7, rebuild the base. Day 1, set a consistent bedtime, take a 20-minute walk, and list every medication and supplement you take. Day 2, 25 minutes of brisk walking, drink more water, cut sugary drinks. Day 3, 10 minutes of slow breathing at night and screens off 30 minutes before bed. Day 4, 15 minutes of basic strength training, nothing fancy, and add more protein and vegetables. Day 5, if you drink alcohol, cut it by 50%. Day 6, reduce overstimulation habits and replace them with real recovery: movement, sunlight, sleep. Day 7, review your scores and patterns. What improved things? What crushed them? Days 8 through 14, build consistency and hormonal support. Day 8, aim for 7 to 8 hours of sleep in a cool, dark room. Day 9, light cardio plus 10 minutes of morning sunlight if possible. Day 10, vessel-friendly meals: more fish, olive oil, leafy greens, less fried food and sugar. Day 11, gentle pelvic floor awareness. Don't overdo it. Day 12, lower performance pressure. Slow down, communicate, remove the test mindset. Day 13, prepare questions for your doctor and do not self-adjust medications. Day 14, evaluate. If you're improving, keep going for 4 to 6 weeks. If you're not improving, it's time for a proper assessment. Here's the takeaway. Erectile dysfunction is not a moral failure. It's feedback. Sometimes the feedback is lifestyle. Sometimes it's medication. Often it's both. But you don't solve it with panic. You solve it with clarity, tracking, and safe action. Medical disclaimer: this content is educational and not a substitute for medical diagnosis or treatment. Never stop, start, or change any medication without medical guidance. Results vary, and there's no guarantee of a specific outcome. Now, 3 things to do today. First, list your medications and supplements. Second, start the 14-day foundation reset. Third, talk to your doctor honestly about sexual side effects. And one question for the comments: did your symptoms begin after a medication change or after your sleep and stress changed?